Hi there, my name is Dr. Abhijeet Kulkarni. I'm here today to go through with you some oral hygiene maintenance tips for effective plaque control. Now, why bother with plaque control? Plaque is a thin biofilm which forms over your teeth and gums almost immediately after you brush them. Plaque contains microorganisms which cause dental decay and gum disease. In our pursuit to prevent these diseases and maintain and augment our oral health, effective plaque control is a very effective tool, especially because it is controllable by the patient and you are in control. How do we go about effective plaque control? We obviously have a toothbrush and use a fluoride toothpaste. Toothbrushes come in different types. This is obviously a manual toothbrush. Manual toothbrushes would come in hard, medium or soft bristle consistency. General recommendation would be to go for a medium or a soft bristled brush. Use a toothbrush with a small head that allows you to go in the back of the mouth or difficult to reach areas with relative ease. There are the electric toothbrushes. This is an example. This is an oscillating, rotating electric toothbrush. You can get sonic electric toothbrushes. They give you an advantage to some extent with consistency. Many will slow down or light up if you brush too hard. Obviously, there is a choice to make. Toothbrushing technique, we normally recommend to go with a 45-degree angle, contacting where the tooth meets the gum, with light vibratory motion or circular motion, avoiding the horizontal scrub technique. We need to go on all surfaces, essentially the outsides of the teeth, the insides of the teeth, and the biting surfaces of the teeth, making sure we clean effectively the inner surfaces of the front teeth. For that, we might need to maneuver the toothbrush in this fashion, and similarly for the lower front teeth. However well we brush, we will miss plaque between teeth. For that, we need interdental cleaning aids. One of them is the floss. Flosses come in different types. They could be waxed or unwaxed, could be different materials. Nylon is a common material. They come in round and or flat cross section. I particularly like the flat cross section or the tape floss. So it comes out of the box about a foot or foot and a half. You wind it around your index finger of one hand, wind it around index finger of the other hand, leaving you a segment in between, which you can then maneuver with your thumb and the middle finger to go between teeth. So the technique would be to go between teeth, wipe around one side, wipe around the other side, and then pull it out, making sure you don't snap the floss on the gum. One useful advantage of winding it around your fingers is that you can wind and unwind the used segment, so you end up with a fresh segment for the next gap. General rule is for smaller gaps and tighter contacts, a floss would be useful. For bigger gaps, you may need something like an interdental brush. Again, they come in different types. They will have a metal wire around which there would be bristles, a bit like a bottle brush. They will have different color codings based on sizes. You can bend them and use them for ease of access. They will come in sort of rubberized forms which essentially don't have the metal wire. Maybe slightly less effective than the ones with the wire, but certainly more effective than the floss, especially in back teeth where there might be multiple roots. So to explain it simply, if that's the root and that's where the roots bifurcate, the floss goes over the convexities but might miss the concave area. So the brush has an advantage. Interdental brushes will come as, now this is an angled brush, so in effect you can hold it and use it with better ease at the back of the mouth. You can get the same interdental brush with a handle with detachable tips, so possibly less plastic wastage. Coming back to the floss, this is a tufted floss. This is especially useful for areas under bridges where you couldn't snap the floss past the contact. So you use this end of the floss to go past the contact, and then use the tufted segment to disrupt the plaque or clean the plaque over the artificial teeth. Something which is useful in special scenarios. There is also the flossettes, which you could use individually between teeth. Many people find them a bit more useful rather than fiddling with winding the floss around your fingers. One thing to note with the flossette though is you can't take it out sideways. So for example, if you had to remove part of the floss, you can unwind one segment and take it out sideways from the tooth or from the tooth contact, whereas with that you're limited with the flossette. Also, once it's been used, you use the same segment on every contact unless you discard it pretty frequently. That's something to consider. Super floss, so that was essentially the tufted floss. A few special scenarios. This is an interspace brush, so essentially a single tufted pointy brush. This may be useful again under bridges, but especially useful for areas behind last standing teeth like wisdom teeth. There might be a little gum flap there which can be difficult to reach and clean under. So this is particularly useful to clean that area and reduce the risk of flare-up, especially around wisdom teeth. Again, this is an interspace brush with detachable heads, so you essentially can save on plastic. Quick note on the water flosser. If there are areas which are difficult to reach, you could have this pulsating jet of water which can go in gum pockets and between teeth. Again, something to consider and discuss probably with your dentist or hygienist and come out with a customized oral hygiene and plaque removal plan. Something to be aware of. I've got this brush, which is especially, again, special scenario would be if a patient were wearing fixed braces. Very important to have enhanced oral hygiene in that scenario, because there's a challenge to keep plaque clean from the various plaque traps which are present because of the brackets and the wire. Get special brushes for that. This is also an implant cleaning, clean around an implant, something to be aware of. General note on brushing. Obviously, advice would be brush twice a day, certainly last thing at night, and then one other occasion during the day. Brush for 2 to 3 minutes. Do not or avoid rinsing after you're brushing. That allows the toothpaste to sort of stay on a bit longer. There's fluoride in the paste and that gets more time to work on teeth. If you had to use mouthwash, we'd normally recommend not using it straight after you're brushing, because it would just amount to rinsing out the fluoride from the toothpaste. So advice with mouthwash is if you would advise using a mouthwash or had to use a mouthwash, use it on an occasion, maybe when you're not brushing, for example after a midday meal. So that's a quick note on mouthwash. Now we've sort of gone through different tools you can use to effectively clean plaque. Now you've done all that, how would you know whether you effectively and consistently got rid of plaque or disrupted it? You have something called a plaque disclosing tablet, which is a useful educational tool or a feedback tool. This particular one discolors plaque which is old in a different color and plaque which is new in a different color. So you may want to use it either before you brush to find out how you brushed the previous occasion, or you might want to use it after you're brushing. Make a note of the areas which you missed and then improve on the cleaning. So hopefully we've gone through the various tools that are available. Obviously this is not an exhaustive list, but hopefully it would have helped you to gain some insight into what is available and how you could monitor how effectively you're cleaning plaque. So do discuss this with your dentist or hygienist to come up with a customized plan, and I hope you find this video useful and I wish you a good oral health. Thank you.